Hi, I'm Dr. Stephen Olmos, and I want to welcome you to this week's edition of Ask Dr. Olmos. Another question we hear is from people who have had a history of having facial pain, jaw problems, and have sought care, and they've been given a splint of some type, and wondering, well, that may not have given them relief of their problems. And so it really depends on what is the activity that's producing the movement of the jaw that causes the inflammation and the jaw joint and the muscles of the face that then gives people symptoms. It all depends on what the origin is. So sleep is very much affected by pain. 50% of all insomnia is related to chronic pain. Because if you're hurting and you go to sleep or try to go to sleep in that state, the cortisol that's being pumped will prevent you from getting to sleep comfortably, or it'll wake you up. If you have an injury, let's say a knee or a hip or shoulder that's painful, rolling around can wake you up. And all of these situations where pain's involved are going to take you from deeper to lighter sleep. And every time that happens, you're going to have some kind of movement of your jaw, your limbs, arms and legs, called that periodic limb movement. Grinding your teeth is in the same category as restless leg and periodic limb movements. They're called movement disorders. And so we have to find the origin. Sometimes it's pain, sometimes it's a breathing problem. So let's say you had obstructive sleep apnea. So in those situations, very often they're positional. A person lays on their back, the jaw falls back with the tongue, blocks their airway, and they stop breathing. And in those people, they have to wake up from deeper sleep to lighter sleep so their jaw can move forward to open their throat so they can breathe. And in that case, that's a lot of rubbing on the skull. So if it's airway related like that, some people's nose is plugged up, they mouth breathe, and that causes issue with the jaw as well. So if we make appliances like the standard night guard type appliances that are made for people that grind their teeth, and the design is to protect the teeth so they don't wear down, but the jaw can still move around. So that's where you can continue to have irritation of the jaw and the facial muscles with those kinds of devices. Plus, if you have obstructive sleep apnea and you're wearing one of those devices, studies have shown that it makes your apnea 50% worse 40% of the time. And the reason is that the jaw's falling back, and with a traditional night guard that only fits on one arch, either upper or lower, the jaw can still move around and fall back. So if you had apnea, your throat's closing, you have that in there, and your jaw's still falling back, but now you have the physical presence of the plastic. Your tongue, which already didn't have room, and which is why, one of the reasons with your apnea, is now being forced away from the plastic to go down your throat. So it could actually exacerbate your problem. So that's why the origin of the activity that's producing your problems needs to be investigated. And devices that sometimes keep the jaws together rather than let them move freely would work better in some of those situations. And so that could be one of the reasons why you haven't had good success. That's all for this week. Thank you for sharing. And if you have questions, please submit them in the description below. See you next week.